Broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the NNN webinar series on cancer risk reduction in Indian Country. This webinar is titled Southwest Tribal Tobacco Coalition. This technical assistance webinar is being hosted by the National Native Network with Indian Health Service Health and Disease Prevention, which offers technical assistance and resources for commercial tobacco prevention and control through Indian Country, and the Indian Health Service Clinical Support Center. Your presenter today is Janna Vallo. She's the Commercial Tobacco Control and Prevention Coordinator at the Albuquerque Area Southwest Tribal Epidemiology Center. We are pleased to offer continuing education credits for participants in this webinar. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses. And to obtain a certificate of continuing education, you must be registered for the course today, participate in the webinar in its entirety, and submit a completed post-webinar survey. We will be sending out a link from the GoToWebinar platform that has a link to the SurveyMonkey, which will include the post-webinar survey. We'll allow everybody about a week to complete the post-webinar survey, and then we'll go ahead and submit the participants to the Indian Health Services Clinical Support Center to help everybody receive their certificates. By the end of this webinar, participants will be able to differentiate between traditional and commercial tobacco and its use, build a community tobacco control coalition that provides cessation support for American Indian adults and youth who smoke cigarettes and those who use other types of commercial tobacco, and implement practices that incorporate meaningful participation from coalition members. During the course of today's webinar, we are going to have a couple of portions of the presentation that will utilize our chat function. So go ahead and type in your responses during the course of the webinar into the chat box in the GoToWebinar control panel. And then after the webinar, at presentation, with about maybe 5 or 10 minutes remaining in the hour, we will be doing a short question answer session. So feel free to type your overall questions into the question box, and I will read the questions aloud for Janna to answer for everybody. So at this time, I'm going to go ahead and throw it over to Janna Vallo.
Hello, everybody. I hope you all can hear me out in the webinar world. So my name is Janna Vallo. I am from the Pueblo of Acoma in New Mexico. I am the Commercial Tobacco Control and Prevention Coordinator at the Albuquerque Area Southwest Tribal Epidemiology Center, or Aztec for short, because that's so long. And I chair the Southwest Tribal Tobacco Coalition. So I hope some of the attendees out there are my coalition members. All right. Okay. So our learning objectives and outcomes, we saw this on the intro slides. I would like to talk about differentiating between traditional and commercial tobacco and its use, but the majority of my time will mostly focus on these two bullets below. building a community tobacco coalition and implementing practices that incorporate meaningful participation. And I think we need to have both of these in order to have a successful coalition. So they work together and they help each other out. All right, so ignore this because I won't be able to see you on the webcam, but I would like you to be able to put in your, chat in some responses to some questions I have. I tried to make it as interactive as possible along with many of the presentations I have. So first one, I logged onto this call with no problem. So if you could chat in A or B, that would be awesome. Give you like 5 seconds to hit your keyboard real quick. Awesome. And now coalition. So another quick chat it in. You are running a coalition. You are a member of a coalition. You are trying to start a coalition, or you're here for coalition support. So you have a coalition and you're just trying to get ideas or to help your coalition out. And not even, it might be great and functioning great. You're just looking for new ideas. And I'm all about that too. All right, so who is out there, and can you explain the difference between traditional and commercial tobacco to not just young people in your community, but just your community? So yes, you can communicate or talk about the difference between traditional and commercial tobacco with confidence. No, but you're learning about it, or you're just a little, but you're still practicing, so you kind of get a little bit nervous, and that's all right, because we are all at different levels and different things, but I think that we can all learn from each other, and that's why we're all here on this webinar call. All right, so traditional tobacco. And I want to start this slide off with just a short disclaimer of respect that we are coming and calling in from across the nation, that we all have different uses for tobacco in our tribal communities, and that we respect those ways and honor the sacredness of it, especially in the privacy of it. And so I think this is probably the hardest conversations I have with communities, but it needs to start somewhere. So the coalition developed this brochure, and it is one of the handouts that you can download, or you can email me or go to the website to request copies of this brochure for free. It's really nicely printed, all glossy and fancy, but it's a way to start a conversation, or it's a way to continue the conversation, or it can be a new angle to talk about traditional tobacco. I have to be respectful in terms of the tribal community that I come from. It's not a woman's thing to use traditional tobacco. And so I have to be very respectful that I don't overstep my boundaries, and know that in my community, it's for the men. But I'm also aware, I have a son who's 9, and he will be beginning to use this as he gets older. And so it's really important for me to let my uncles, my brothers, my dads, my grandfathers know that I don't want him using commercial tobacco during our traditional practices. And so this is one of the conversations I'm able to have because I'm his mom. But in terms of teaching about it, I think it's very important that we address that we honor those who are able to have the support of communities to talk about their traditional tobacco use. And so I always look for a community champion, a person within a community who's been honored with the responsibility of teaching about traditional tobacco. And so I say that with great respect, because every community that I go into, even my own community, because I don't work there, and I work through this organization and through my coalition, that I be respectful of how I enter. And so I try to find those people who can help me have that conversation, or who I need to bring in to have our conversation around traditional tobacco. So, commercial tobacco. I needed to just shout out those resources to make sure that we get information that is researched and been verified by our different educational systems or funding sources, or where our information is credible. And so a shout out to the CDC, the FDA. And if you haven't had a chance yet, go and get lost in the tobacco industry documents. Holy cow, there is such a wealth of information that you can look through and search out things around how big tobacco is targeting American Indians. I also put up this resource because right now it's the thing that I'm working off of, and I really like how it's this infographic is made. It's short, it's pretty simple, and when I talk about commercial tobacco, I don't do it like just all at once. I take pieces of it and I turn it into activity, and a lot of these activities I try to have our coalition members go through. So I'm not only providing information about commercial tobacco products to the coalition, but I'm teaching it in a way where they can be involved. And so in this next slide, this is one of the activities I've done with my coalition. And so you'll see on the floor that I've taken the 70 known cancer-causing ingredients in cigarettes and just printed them out and thrown them on the floor. Or I've had the coalition members throw them on the floor. So everyone is standing in a circle and they're throwing out these pieces of paper, looking at them, maybe reading them out loud. And sometimes we just need to feel what that looks like, or have a name to some of these ingredients. Finding that list was a lot harder than I thought it was going to be. I had to go through a couple journal articles, the different websites, just to get a list of all these names. And so these are things that we share and teach our community, but how do we turn it into an activity? And I come from an experiential education background, so we learn by doing through game. And so I've tried to incorporate all of this into how I run the coalition. And so you'll see on the bottom picture that there's different other messages kind of floating on top. Well, we do this web activity where you take a ball of yarn and you throw it across to each person in the circle, so everyone is hanging on to that web. And so we talk about, what are our strengths? What do we hold? What commonalities do we have? How many youth aren't using? And then how do we catch those who have fallen through the cracks? How do we help support them? And so this is one way to talk about how commercial tobacco is affecting our tribal communities in a way that's interactive. So if you're looking for a new activity within your coalition, shoot me an email and maybe I can get you the little guidelines I have for this activity. And then of course, make it your own, make it to what will fit your coalition. All right, so chat in your answer. Which of the following chemicals is not found in tobacco smoke? Give you a couple seconds. Are you ready? Are you ready? Here we go. Chlorine bleach. So out of chlorine bleach, rocket fuel, nail polish remover, and barbecue lighter fluid, chlorine bleach isn't one of those chemicals found in tobacco smoke. And so I always try to incorporate games and activities just so that I keep it interactive. How can we remember these little tidbits? And how do we get our community to remember those little tidbits as well? And so I wanted to share, and I'm super excited to share what's been going on with the Southwest Tribal Tobacco Coalition. And the best way to start is with its mission. So the mission of the Southwest Tribal Tobacco Coalition is to acknowledge and collaborate with tribal communities in honoring and respecting the sacred use of tobacco by educating people about the differences between traditional and commercial tobacco and its use. And so the coalition was established back in 2004. I wasn't a part of it at the very beginning. I came in much later, and I didn't become the chair of the coalition until around 2011. And so it's always good to acknowledge that coalitions have different stages and levels of readiness. And so we think about this through like the 5 stages of group development. So forming, storming, norming, performing, adjourning. I've also heard it with transforming. And so, if that's a whole different webinar, but, really understanding where your coalition is and how to get them to that next step is really essential in having a well-functioning coalition. And so one of the things that has really helped me in terms of being a coalition leader is this: position the audience as the hero. So if you're not driving in your car and listening to this, and you are at your desk and not standing up, if you could stand up, and I want you to assume that superhero pose. So feet shoulder width apart, stand straight up, pick your head up, put your shoulders back, put your hands in a fist and put them on your waist, and really assume that superhero position, because I think that's important. We guide the audience along their personal journey of change. We become the mentor in their story and whisper guidance in their ear, empowering them to be the agents of change and achieve greatness. We provide them a magical gift for ways of deliberately enriching their audience in a meaningful way, or their community in a meaningful way, and a gift to be that hero in their community. So we're giving them something useful, something out of the ordinary, something memorable, and a unique experience. We give them the value, the tangible value to teach a skill. And so how do we help celebrate those victories? How do we help them get unstuck? How do we help them get creative ideas and encouragement? So I always use this as when I prepare for my coalition, I kind of have to psych myself up. I stand in my superhero pose and I prepare to create a coalition where they are the heroes. You can sit down now if you stood up. And so now I want to shoot this over to Mike to play a short little digital story that I made about my coalition. Awesome. So that is a little video I made. Talk about the hardest thing to do for me. But it was also very fun and very rewarding, surprisingly. All right. Do I have control? I don't have control of the slides. Okay. All right, so what does that mean? And it's a little bit different. I just want to say too that I'm still learning every coalition meeting and in between coalition meetings. I know there are still things that I can improve on, but there are things that seem to work really well. And depending on where you are with your coalition, I think just understanding what your coalition wants and the structure that you need to make it work can be really helpful. And so this is an example of a couple of our agendas. I try to, I'm not very good on time, like this time to this time. So I do more of like a general, this is everything we're gonna hit today. I also encourage partnerships. And so you'll see in that longer agenda that I've partnered with the American Cancer Society Cancer Action Network, which is the lobbying portion of the American Cancer Society. And so it's really great for these partnerships to happen because not only do you incorporate a lot of learning, but you get help. So you're not just in charge of running the whole meeting. And so we've been able to help bring in other people, again, positioning our audience as the hero. So I think a huge part of my agenda is how can I get my coalition members to also be the presenters? And so here's another meeting structure. I use this sometimes. I don't use it all the time, I guess, depending on how I'm feeling that day. But I really like this because it gives us a path through our meeting. It's not very structured, but it's, you know, we're going to hit some things. You see the Post-it notes attached to it. And so maybe breakfast showed up late because I had it right at the welcome and I needed to move it to accommodate for time. So we decided to put it later on in the agenda. Or maybe my breaks need to move around. So this is a great way, or we need to add or change things in terms of how do we get through our day. If I started out like that, but my roadmap to get there might be a little bit different, know that I'll hit all these things on my agenda. And just a shout out to the Healthy Native Community Partnership because they taught me this method. And so, you know, how do we learn from our resources and from those trainings? And how do we take what we've done and really incorporate it into our daily meetings or into our daily work ethics and all these types of things? Because I am not organized at all, but I have to find ways to get me there. And so this is one of the things that has really helped me to get through an agenda. The other thing that I think is super important, and depending on how bought in your coalition members are, we have to set a clear foundation for how we get them to be involved. And so I like the group agreements method. And so when I prepare this, I'm always like, how can we make this meeting fun and inspirational and productive and interactive? And so it's really getting the group to buy into these agreements. And then I always try to get them to manage themselves. So it's not me always saying like, hey man, turn your phone on silent, you know, but it's always like better if the person sitting next to them does it quietly and like, hey, you know, can you put it on silent? The vibration is really distracting me. And so then we help them help each other. So we're creating this environment where we are able to be fun and to be inspirational and productive and to have those interactions, because I think networking is a huge part of coalitions. I always try to incorporate activity to provide networking. That way they get to know each other just past what's going on at the meeting, but what's really going on in their communities and where those challenges are, because it's through those challenges that we can help to create discussions so that we can change those norms. And then to also, really check in, like, am I doing a good job? What's my plus and delta? What am I doing good at? And what do I need to change so that everyone's time is being used valuable, or I'm aware of everybody's time, and I respect that time because they are taking time out from their community to travel to the meeting, to spend a half a day with me or maybe an overnight with me. And so how does that look, and how can I make it meaningful so that they can take it back to their community? And so really, if we have time at the end, I've asked a couple of them to either, if they're able to talk about how the coalition has benefited them, or to either chat it in about how the coalition has benefited them, or what takeaways they have gotten from it. And so I really try to really have this back and forth agreement with them. And so this is just one of the ways. I know there are many ways to do it. I always try to write in 2 different colors. So you'll see like pink and brown or blue and purple. So that way our mind acts differently to the different colors, but it also knows that these are separate things to talk about, and really how big. So I'll usually be walking around with my big Post-it papers and, trying to stick them on the wall. I have a little baggie of different size Post-it notes, just in case I need to do a quick, like, okay, everybody check in type of deal. So I think that's very important. The other thing that I think is super overlooked sometimes in running an agenda is finding out why people are coming to the meeting, finding out what's going to get them back to your meeting, back to being a coalition member, and maybe an active coalition member. So one of the very first activities that we did when this coalition was relaunched was to really find out what coalition members want to know about. So we did this Res Cafe activity. You can do other idea generating activities, and it was really for them to tell me what they want to know about. What types of tobacco trainings do they want? What type of skills do they need to have these conversations in their community? How does this look? And so we were able to take this information. It's a good thing that my program evaluator has also been a part of the coalition since its beginning, has really helped me capture all of this. And because he speaks evaluator mode, I think that's super helpful for me, because then it's able to be put into a document, and then it's like a checklist for me. Did I provide this information to them? Did I help get all their needs met? Are they coming here and really getting what they need out of this time that I have with them? And so I know that I'll be doing this again probably early next year, because I'm like whittling down on this list, like, hey, I did that. And then, what I need, what they want more of, or what I need to get others to come in. And then also acknowledging the expertise that's already in the room. What do my coalition members have to offer, and what are they willing to present on? And I think that's really great. That it's not just me up there talking, although sometimes it feels like it is. I try to incorporate them into my agenda, and so I really talk with them about, hey, I heard you were doing this. Do you think you can present on it? And I think I forgot to mention that a huge part of my coalition is giving time for different tribal communities to present on traditional tobacco. And so ways that each community is keeping their traditional tobacco usage alive in their communities varies. And so I want to acknowledge all these different ways that these communities are doing it. And so one way is to have them share. And so I try to get a different community to present on what their traditional tobacco program looks like. And so it's not like, it's not, a lot of the times it's just spoken, because in many of our communities it might be like through our histories are passed down orally. That's how my community is it's not written down, it's passed on through story and through, you know, rites of passage for our community. And so I think that's important to acknowledge, that the way that each community does it works for them. And then we're here to help generate ideas or try something new, or if something didn't quite go right, how can we help them? And so those are different things that I try to incorporate into my agendas, and how I incorporate their ideas into those agendas. The other thing that I wanted to hit on, because we never know if a lot of these times these coalitions might be other duties as assigned, or it might be an existing coalition and then they say, oh wait, you got to talk about tobacco now, so here you go. So I always think about, how do we fund this coalition? I'm super blessed to be at a place that's able to help support the coalition, but I also know that it's very important to find other sources of funding. And so right now we have a couple different sources of funding, but when we think about it, it's not just going out and getting any funding, because we really have to think about, what is your coalition able to do, and what are they willing to do, and what are they wanting to do? And so being able to answer those questions before you just submit to any funding sources, I think it's important to include the coalition on some of those decisions. And so I think about, what do I need to help me get this coalition running? So we think about meetings, and can people attend them? Are there barriers, and how do we reduce as many of those barriers as possible? Food, we got to have food, and sometimes these funding sources are very restrictive. They're like, no food, and you're like, how can we not have food? And so it's always great that you're able to provide breakfast or, you know, lunch, because maybe that morning they got to get their kids to school, they got to get to work, they're running late, they're running into the meeting, and they're like, they hadn't eaten or had their coffee. How can I help them get to the place where the meeting can be meaningful and supportive for them? So it might be having that hot cup of tea, Indian tea there, or a cup of coffee or burritos. And so I'm able to do that with the various funding sources. Also providing travel support. So we serve the 27 tribes in the Albuquerque area service unit. So that's all of New Mexico, Isleta del Sur in Texas, and the Ute tribes in southern Colorado. And so how do I get them to my meeting, because I'm based in Albuquerque? Or if we travel to different places, because we have one meeting in Santa Fe every year, how do I get people to that Santa Fe meeting? Is it providing mileage? Is it providing lodging? How do I get my coalition members there? And so this is just one of the ways that I found, you know, looking for unrestricted funding sources to help them get there. How do we provide additional meeting support? So we also have other state tobacco meetings, and I want them to be a part of those conversations as well, to hear about what other coalitions are doing in New Mexico regarding tobacco. And so being able to say, hey, do you want to go to this meeting? I can help you out, you know, or asking the other coalition members or meeting providers, like, hey, my coalition wants to attend. Is there a way you can help them get there? So really, you know, how do we build on these collaborations? How do we network with all these other groups working on the same cause, reducing commercial tobacco use? And I always think that's pretty important for, and what's fun about too having our coalition, because it's not just us, it's a group of people coming together with the same mission. And so as you heard in my video, I really wanted to focus on what the coalition cares about. So these two topics are what the coalition cares about. Indigenous data sovereignty and the development of appropriate materials that fit them. And so I'm a collector of materials. So if I go to a conference somewhere, I am like collecting everything about tobacco, and then I put them all together and look at different ways we're using them, um, different ways to help us out. And I like some, I hate some. I'm like, well, this is cool and this is cool, but I don't know about that part, or I hate this one because of this and I want to do something different. So how do we create appropriate materials? The Indigenous data sovereignty, I'm super blessed to work with my boss. This is her theme. She is into this. She loves Indigenous data sovereignty. So it's really great that I have that resource right here in the office next to me to help me talk about this, to help me really help tribal community members know that this is their data and they have a right to how to use it. Like, how are they using it in their community, and what is it saying about them and the message that they present? And so what we've really done is given that power back. And so how does this happen? Well, we're still doing it. It's a living theme within our coalition, and so we needed to start somewhere. So we did a question bank. We try to look at every single question that tribes are asking, what questions are out there. We've contacted all the tribes and have asked, hey, do you have a survey? Have you done a survey around tobacco, either commercial or traditional? Do you think you can just send us the survey? We don't want your data. We just want to know these questions. And then the next step after gathering all that information is, okay, so what have we learned from these questions? And what is useful to communities? What information do they need in order to create programmings that are specific to that community? But I think the overall question is, how do we stay good relatives? How do we make sure that we're not exploiting any information or any methods, but how do we be respectful of that? And so those are huge things when it comes to data, when it comes to running our coalition, when it comes to making appropriate materials. How do we make sure that it fits our coalition? And so some resources that the coalition has developed. So this first brochure, the Tobacco Keep It Traditional, that is actually a handout that's you can download and use, or you can email me and I can mail you some. We have them printed on super nice glossy paper. It's a bifold lengthwise, and it's really nice. The second one is a comic that was created. It hasn't gone to print yet. It's actually in the process of being printed. So it's two different comics, but it's really, it folds out into this poster, and it's really, how do we help our loved ones quit tobacco? And so there's two comics of these young people going through how they're battling from using commercial tobacco. And so we just contracted with a local artist, and it's really, how do we use that local talent, and how do we get what people that look like us and that we can connect to in these stories to help carry out this conversation. And so right now the coalition is working on a coloring book or activity book. And so we're really trying to get something that fits our area, that looks like us, that feels Southwest, that, you know, is also appropriate. And so this is one of our subgroups. And so we're really excited that the group has taken on. So they edit it. They're like, no, we don't like that. Take it back. We want to do this, or, oh, make sure you add this. And so it's really a back and forth conversation. Okay. This is one of the latest resources that we have created for our coalition. And so we actually took something that was created by the American Indian Cancer Foundation. So shout out to you. I hope somebody is on the call from there. They actually helped us utilize this infographic and make it fit us. And so that bottom corner infographic that's bright green, that was their original infographic. And, you know, we thought, hey, this is a great conversation starter. This would be a great way to talk about policy and what it looks like in tribal communities in all these different areas. But we're not green at all out here. We are desert, we are brown, we are hoping for rain. And we wanted to make a little bit of changes. And so we had, with their help and their graphic designer, create 4 additional infographics for us. And as you can see in the center circle, they're all just a little bit different. And so we wanted it to fit the larger tribal groups that we serve. So we have one for Pueblo, and I put that one in the center because I'm Pueblo giving this presentation. But we also created one for Navajo, Apache, and Ute. And so it was taking something that we really liked and making it fit our community. And so these posters are available free as a resource. But I just think it's really great that we can see things that are already created and we really like the layout or the look of it, but how do we make it fit us? And so I'm really thankful that they were willing to help us out on this. Awesome. And so I think that part of what makes this coalition work is always remembering that we're part of something bigger. I think being on this call reminds me that I'm not just in New Mexico, but it's a national effort that we're all trying to work to address commercial tobacco use in our tribal communities. But also sometimes we get so caught up with what's going on in where we work and in our tribal community that we forget there's something going on in our state. And so I've really tried to remember that in terms of how do I know what's going on in the state? And so one of those agendas you saw earlier was in Santa Fe. And so we have worked our coalition meeting to take place in Santa Fe during the New Mexico legislative session. And so what's really interesting is that it provides tribal programs the opportunity to advocate. And so we have some partners come in and really talk about what the difference is between lobbying and advocacy, and how do we make sure we stay on the advocacy side, and how do we also allow partners who are able to lobby, allow them information to lobby. And so we created this with the help of the American Cancer Society Cancer Action Network, ACS-CAN, here in New Mexico. And so they really helped me create these documents. I just kind of slapped my logo on there, the coalition logo. And so you'll see in the top corner, that little square is actually a quarter sheet of paper printed on both sides, and they're a lot smaller. And on the other side is just lines for a program to write, hey, this is how this funds this program. These are the successes of this program. If you would like to know more, give me a call at this number. And then the coalition information is on the other side with the coalition email. And then there's this other handout that we really help coalition members practice. And so we know that many coalition members are not allowed to lobby, but they can advocate. And so you'll see the who I am and why I care are huge pieces in advocacy, and not so much the ask, because if you start asking, then that's where that lobbying piece comes in. So we have the conversation. we practice it, because sometimes what we think and write might not always come out the same way. And so we practice it. And sometimes we're like, wait, that's bordering on lobbying. Let's go back and say it again. And these are the people I need to visit. And so these are other people within the state. You'll see in that second page, there's actual names of people who control the tobacco funding in New Mexico. And I think it'll change again because the elections are coming up. But, this was last year's document. And so how do we get these conversations to happen? And really, it was really, it's called the Roundhouse here in New Mexico, and it's a little bit intimidating. I still get intimidated sometimes, but I think the great thing is that we are able to provide the opportunity to just be in that space if they're not ready to have those conversations. But if they are, it's really great that they're able to go and visit, because we elect these people and they are human too. So we should be able to have those conversations and really be those advocates to help changing the environment around what we see with commercial tobacco in tribal communities. And then sort of in closing, just give a shout out to my organization, and something that we created is this e-guide, and it's available online on our website. It has full interactive links. So if there are different policies or different types of information you're looking for to talk about different aspects of commercial tobacco prevention, this is really great. The National Native Network link is also within this document, and different tribal serving organizations. It probably needs to be updated. It's over a year old now, but really it's a way to start the search, start the research, start the process, start the conversation, ways to get resources to communities. If we can't print it, it's online where they can print it, or if they need assistance, or they can't, get these items, then we're here as that resource. So that's kind of how I see myself in my coalition role, is I'm that resource to help them have those conversations. Awesome. So thank you all so much for your attention and for your time spent here with me today. And here's my contact information if you need to get a hold of me, or if you have questions, like you're this afternoon and you're like, oh, I have this question, shoot me an email or send me a text and let me know, and hopefully I can be of assistance to you. So thank you all so very much for your time.
Well, thank you very much, Janna. We appreciate having you take the time to present today. So we've got about 10 minutes left. So if anybody has any questions for Janna, feel free to type them into the question box in your GoToWebinar control panel. Make sure that you type your questions into the question box. And then I will go ahead and answer the question aloud, or ask the question aloud, so that Janna can answer it. While everybody is doing that, I want to go ahead and give a plug for the National Native Network's website. Our website is keepitsacred.org. And tomorrow we're going to go ahead and put up the archive of this webinar up on keepitsacred.org. And if you follow us on social media, on Facebook, Twitter, LinkedIn, and Instagram, after we post it up on the website, we'll make sure to share a link to the webinar on all those platforms right there. So it'll be easy for folks to find. So go ahead and keep us updated on that. Also, we do want to remind everybody that tomorrow we will be sending out a link to the post-webinar survey. So if you wanted to get your continuing education units for participating in today's webinar, make sure you click that link, click through to the survey. It'll be from SurveyMonkey, and just go ahead and give us some feedback on how the webinar how the webinar did today, and we'll go ahead and after about a week or so, we'll send that out to the Indian Health Center or Indian Health Service Clinical Support Center, and hopefully we can get everybody their certificates for their CEs here in the next 2 to 3 weeks or so. So in the meantime, well, I haven't seen any questions pop into the question box yet. Janna, did you have anything else you wanted to add about the presentation? Any additional information you wanted to tack on? Maybe even touch on the handouts that we uploaded into the GoToWebinar platform today?
First of all, just again, thank you, especially to my coalition members. I was like, thankfully, you gotta call in. So thank you to all of you who did a call in. I'm gonna ask you at the next coalition meeting. So the handouts that we have online are the presentation, and then and really it's the Keep Tobacco Traditional brochure. And so it's two of them, the in and the out. So if you print front and back, and it's just on a regular 8x11 sheet of paper, but folded lengthwise. And so that's there for your use. But if you would like the fancy version, go ahead and shoot me an email and I can mail them out to you. So don't forget your mailing address. But yeah, so I hope it was helpful and thank you all so much. I don't know if you have any questions, let me know, or if you think of any later, let me know. But yeah, that's pretty much it.
We did have one person that asks if they'll have access to the slides after the webinar. When we do upload the webinar onto the website, I'll typically create a YouTube embedded video on the webpage, and below that you'll have access to all the handouts and the PowerPoint presentation as a PDF file. So folks will be able to download all the material from there. Otherwise, we don't have any questions, so I think that we can go ahead and wrap up a little bit early today. And with that, we want to thank everybody for attending the webinar. Again, be sure to follow us on social media in case you have any friends that may have missed today's webinar. You can go ahead and share out the link to view the archive of the webinar tomorrow. And also tomorrow, make sure to keep an eye on your email. There'll be some email coming to you from GoToWebinar. Click through the link, and it'll bring you to SurveyMonkey. And if you could just go ahead and take the time to complete the post-webinar survey, usually takes about 5 or 10 minutes, and offer your feedback, and we'll go ahead and get everybody their continuing education units from there. So again, thank you very much to everybody for attending, and we hope you have yourselves a great day.
Have a good day, everybody. Thank you.
Thank you.